So shout out to my classmate Blarina for requesting this one, all right? So we're diving into burns. Here are 10 multiple choice nursing questions. Guys, remember, if I'm going fast, pause the video if you need time to think, okay? And remember, the full rationales are down in the caption or in the comment section, okay? Drop your score below. Let's go. Question number 1. A nurse is assessing a patient with a first-degree superficial burn. Which clinical manifestation should the nurse expect to find? So the answer is C, erythema and skin blanching on pressure. Okay, question number 2. The nurse notes that a patient's burn injury has destroyed the entire epidermis and varying portions of the dermis, now presenting with erythema, blisters, and mild to moderate edema. How should this burn depth be classified? So the answer for this one is B, second degree partial thickness. Okay, question number 3. Which method of estimating total body surface area is highly recommended for infants and young children because it corrects for their large head to body ratio? So the answer is D, Lund and Browder method. Question 4. A patient with a major circumferential burn to the left lower extremity is at a high risk for vascular compromise. Which nursing action is a priority to monitor for the development for compartment syndrome? Okay, guys, so the answer is A. You want to assess the pulse distal to the injury. All right, question number 5. During the emergent phase of burn care, what is the priority fluid resuscitation intervention to treat hypovolemia and maintain organ perfusion? The answer is B. You want to infuse isotonic crystalloids like lactated ringers, right? Question number 6. When evaluating the effectiveness of fluid resuscitation during the emergent phase of a major burn injury, which finding is the most reliable indicator of adequate perfusion? So the answer is B, urine output of at least 30 milliliters per hour. Question 7. A patient is admitted following an electrical burn injury. Beyond local tissue damage, what is the priority system alteration the nurse must monitor for? Guys, so the answer is B, cardiac dysrhythmias. Question number 8. Well, a patient is admitted to the emergency department with suspected carbon monoxide poisoning after a house fire. The patient's pulse oximetry reading So the answer is B. You want to administer 100% oxygen via face mask. Question 9. How long can edema take to fully develop in the upper airway during the acute intermediate phase? Guys, so the answer is C, up to 48 hours. Question 10. What is the priority intervention for a stable client who has sustained a chemical burn? Guys, so the answer is C. You want to brush the chemicals off and remove contaminated clothing, okay? Guys, that's it for this video, all right? I want to thank y'all so much for participating. Please leave your answers in the comment section below. Remember, the rationales are going to be either in the comments or in the caption, all right? And remember, I'm always leave y'all with this. Never dim your light for anyone. Stay lit.